Hi, and thank you for joining us right here at a co-event between Breast Cancer Answers and Prostate Cancer Live. Dr. Jay Harness, our medical director for Breast Cancer Answers, is with us, and also Dr. Rich Bevan-Thomas, the medical director for Prostate Cancer Live. Dr. Harness, how are you?
Hey, Todd, I'm good, and it's great to be here at another live Google Hangout.
Really nice to have you, Dr. Harness. Now we also have Rich Bevan-Thomas. RBT, how are you?
I'm good, Todd. Thanks for having us. This will be a good one. We'll see what happens.
This is a really interesting conversation. It comes up a lot on our sites, and that's why we're joined right now by Dr. Devra Davis, the author of The Secret History of the War on Cancer and Disconnect, the truth about cell phones and radiation. Dr. Davis, what an honor to get to spend a few moments with you. Thank you.
The honor is mine to meet with my distinguished colleagues, at least online.
Now, I know that that both medical directors are going to have some questions for you, but let's just start off at the very beginning. What is the claim or argument that you're making about cancer and its connection to cell phones? Bring us up to speed on that.
Well, basically, most people are unaware that a cell phone is a two-way microwave radio, and that within the phones today there are warnings to keep them some distance away from the body that manufacturers provide that are buried within the operating system of the phone. What we know is that microwave radiation can actually cause damage not by heating cells, which is what was believed, but by initiating or promoting cancer. And either one, as these doctors know, either initiation or promotion, can lead to cancer. And we know that from studies that have been done in cell cultures, in whole animals, and most importantly, unfortunately, growing evidence in humans. And the evidence is strongest with respect to epidemiologic studies, case control design, on brain cancer, glioma in particular. But we are deeply concerned about breast cancer for reasons I can explain a little bit later.
Now, Dr. Harness, you being a breast surgeon and a past president of the American Society of Breast Surgeons, what do you think to yourself when you see a patient or you see a woman in public that's got her cell phone in her bra? Does that raise a red flag to you?
Yeah, it does, Todd. And actually, as you know, we've done a couple videos previously here at Breast Cancer Answers on this very subject, particularly the young women, particularly the teenagers. The young developing breast is so vulnerable to radiation. For instance, if we have a patient that has a lymphoma and needs a mantle of radiation, that young woman later in life is at an increased risk for breast cancer. So Dr. Davis is right about this. One of my colleagues here at St. Joseph Hospital in Orange, California, Dr. John West, has also reported actually in the medical literature about some anecdotal cases of younger women, the cell phone in their bra over a prolonged period of time and developing breast cancer at that precise location. So I'm sure that Dr. Davis will share more information with us on this. And also a previous video that we did, Todd, we really urge people to use their speaker phone on their cell phones or some other connection, but not be holding it constantly up to the side of their head, as we see thousands of people do on a daily basis.
Now, I would like to make sure that each one of the medical experts that are here are able to talk, and I can back away just as long as, you know, like Rich Bevan-Thomas, if you have a question, you're welcome to jump in. I want to make sure that I'm less of a distraction and the three of you can have the conversation. But out to Dr. Bevan-Thomas, what about cell phones? And, you know, you're a urologist. How does this play in? Are you seeing anything we should know about?
So, you know, the answer is not that I know of. And again, I think that, you know, and again, this is, I think, a good, you know, question for Dr. Davis is, you know, it seems as though that the challenge that we have on cell phones, it is related to a proximity issue. And fortunately, unless we actually have the cell phones, and it's pretty tough to get those cell phones near your prostate. I'm sure it could be done, but you know, fortunately, we try to keep those cell phones away from, you know, down south of the belly button. Although there are some guys actually that put the cell phones in the pockets, and that's obviously a challenge too. So, I mean, I haven't really seen much, at least in the realm of prostate cancer, that's really been popping up. I think that, but I think, it's something that obviously right now, at least, for the limited amount of reading that I've seen on this, it seems to me primarily, obviously, associated from the brain issues. Now, so Dr. Davis, am I right on that? Is the fact of, yes, it can say DNA, but is it a proximity issue or is it a general issue from a DNA, issue that throughout the entire body?
Well, you've nailed it precisely. It is unfortunately both. And so you're absolutely correct about the proximity concern, and that is why all phones today come with warnings that few people read that says that if you keep it in your pocket, you're exceeding the as-tested exposure guidelines. We're launching at Environmental Health Trust a campaign to make sure people are aware of this, and just last night the Greenbelt City Council passed a determination by a letter that they are going to warn people about the warnings that are in the phones that people don't know about, that say you don't keep it in your pocket or you're exceeding the as-tested exposure guidelines. Now, what you may not be aware of, because you work on a different aspect of male reproductive health, is that the Cleveland Clinic, along with other major centers of men's health, have recently reported that men who keep cell phones in their pocket the most have the lowest sperm count with the most effects on morphology, motility, as well as mitochondrial DNA damage. Mm-hmm. And lowered sperm count, which we know can be a marker for all kinds of other things, as well as biochemical indicators of damage to sperm. Now, this is, I think, a very serious issue for male reproductive health. We have growing infertility problems in young people today. We can't separate out all the different causes that we know can be contributing to this, including, saunas, tight underwear, things that are known, as well as cell phones in the pocket, which could certainly be a risk factor, so much so that Stan Glantz of the University of California, San Francisco, published a new chapter in his book on biostatistics in medicine, where he said cell phone radiation clearly damages human male sperm, based on a meta-analysis that he conducted for the textbook purpose of looking at all the human data that we have now on damage on sperm. So you're right, we don't have the data on prostate cancer, and the reason I wrote my book, The Secret History of the War on Cancer, and the book Disconnect, is we cannot afford to let the lessons of tobacco and asbestos play out again and again. We've waited too long to take action on those things.
Dr. Davis, I think what you just referred to is how many years went by where people were smoking but didn't know the connection, and is this going to be one of those topics in 20 years where our kids or grandchildren will say, wait a minute, you used a cell phone?
Right.
Well, no, look, I use a cell phone, guys. Look, this is how I use it. This is how the mayor of Greenbelt uses it. This is how the mayor of Jackson, Wyoming uses it. This is how the mayor of Samsung, Turkey uses it, with a headset or a speakerphone, and it works. And by the way, at my age, I can hear with this thing, which I can't hear otherwise. So I don't think we're going to tell people you used a cell phone and they're going to give it up. I think what's happening now is there's going to be hardware and software changes. There are cases like the Pong case that can reduce radiation, and there are safer ways to use phones. And just as Dr. Bevan-Thomas said, distance is your friend. Keep it away from the brain and the body. That will go a long way to reducing your risk. The interesting thing, Dr. Harness, about the cell phones associated with breast tumors was that the tumors were subcutaneous, multifocal primary, right under the antenna of the phone. The fact that you got two of these cases that were age 21, that one of them was Chinese American, that they were all very healthy, you know very well those are low risk factors for breast cancer. 21-year-olds are not supposed to get breast cancer, let alone multifocal primaries that are, by the way, in the center of the chest and not in the upper outer quadrant where most breast cancer normally occurs in older women.
Yeah, no, I'm not going to argue with you at all. It's always amazing, here in a hospital where I've got women running around in scrubs who work in doctors' offices in the OR. I see a lot of them carry their cell phones in their back pocket, over the buttocks, and then still, despite everything everyone has said, trying to get them to keep it out of their bra, for crying out loud. But no, I think in those cases that have been reported, I think the evidence is pretty strong.
It's unfortunate because, as you guys both know, a well-done case report, a clinical case report in medicine is often much more powerful than waiting and waiting for us epidemiologists to get our act together, because that will take another 20 years.
Well, Dr. Davis, I've listened to the debate going on and on and on about brain tumors. After Senator Ted Kennedy died of his glioblastoma multiforme, it sort of surfaced again. Where are we as far as today on the epidemiologic evidence vis-a-vis brain tumors?
Well, actually, just this year, the French published a very large national study on case control design of gliomas. And one of the problems we have is the power of our studies to find an effect is limited. This study in France, the study in Sweden, and a study of the Interphone collaboration, they've all found the same thing. Once people have used a cell phone regularly for 10 years or more, there is a doubled risk of glioma, and in the recent analysis in the French data, those who used a phone longer or heavier have between 3 to 8 times more gliomas. Now, that is a huge number that we do not usually see except in drugs studies, as you know very well. So I think that at this point we've got enough evidence that my colleagues and I, some of whom have worked for the International Agency for Research on Cancer, have recently published a peer-reviewed article which we'll make available after the Hangout, in which we conclude that cell phone and other wireless radiation should be classified as a probable human carcinogen, IR class 2A, and not 2B, a possible human carcinogen, which is what the World Health Organization concluded in 2011. The evidence, the human evidence, has become stronger, and we don't want to wait until it gets even stronger yet.
So, Doctor, let me just ask you a question, because I was reading a couple articles on this, and one of them they talked about the U.S. National Toxicology Program, and they were doing a study on rats, and allegedly this is apparently they were going to expose these rats to about 3 hours of cell phone radiation a day. I get, like many studies, they say this is going to be very helpful to let us know. Obviously, it's a rat study. Do you think that's going to help in the cause-wise on this or not?
I think it will help, but as you indicated by the nature of your question, it's really hard to get rats to make phone calls.
Well, if you train them, we can train them to do lots of stuff.
And so
it's hard to get them to use a smartphone, but maybe a flip phone.
But the point I'm trying to make here is that obviously we've got to estimate and approximate and model animal exposures. And that's tricky. I mean, it really, especially in this situation, because you cannot go to the maximum tolerated dose. If you did that, you'd basically cook the animal. You can't do that. Right. So I believe that the NTP results will be useful, particularly some of the shorter-term studies where they're looking at some of the chronic effects. But the fundamental a lot hard to get animals to make these calls. And so Dr. Hugh Taylor recently in Yale produced a study that I thought should have caused shock waves throughout the embryology community. He showed that prenatally exposed pregnant mice developed offspring with a significant alteration of their behavior, and other studies have found damage to the hippocampus. The hippocampus, that's critical to memory. That could be involved in sudden death, as my colleague Joel Moskowitz recently raised that question. It could be involved in autism. If you're having an effect prenatally exposing rodents, causing damage to the hippocampus, the pyramidal cell formation in animals, this should be a huge warning. And
okay, so pardon me for just a moment. Our audience is the lay public, and I'm not sure if anybody knows what a hippocampus is. And I have pictures in my mind of what a hippocampus is.
All right.
But I think we're losing our whole audience. So if we could, what's a hippocampus?
Sorry.
It's all right.
I got carried away by my stimulating colleagues here. It's a part of the brain that is critical to memory, to thinking, to decision making. It's basically very essential. And what these studies have shown is that animals, mice and rats, that are exposed prenatally to cell phone radiation develop fewer brain cells. How's that?
I think that's
so. Let me kind of follow through with that on the second question. Is that so? We've obviously got this concern, and maybe we're 20 years behind ourselves that we were with smoking and the other stuff. Although that was kind of clearly made sense that you're obviously putting some smoke in your lungs. That obviously was like not a good idea, even if you had a Marlboro Man on there. But I think the issue is that is Bluetooth? I mean, because I don't know any data, at least from a Bluetooth perspective, that that's going to be a challenge for this. I mean, can you expound on that? Maybe is that a safer way to go?
If you are not sensitive to this radiation, for short periods of time, Bluetooth is certainly valuable, but I want to tell you, if you use a Bluetooth and you have this phone in your pocket, on your body, forget it, because you're reducing your exposure to your brain somewhat, but you're increasing it to your body, which is not a good idea. I recommend speakerphone, headset, and remember, distance is your friend. So these devices should be used away from the body, and warnings are being given now by the cell phone manufacturers, and we at Environmental Health Trust are promoting awareness of these warnings through our various campaigns.
All right, so I had a conversation, probably about 6-8 months ago. I was in Dallas, Texas with Dr. Bevan-Thomas, and we had a similar conversation. We were talking about the Wi-Fi signals and plants that are put next to the Wi-Fi router that they end up not living. And so I kind of have decided with my phone that whenever possible, it's out of my pocket on the other side of the table. And if I'm in the car, it's out of my back pocket and it's up on the in the ashtray or something. As you mentioned, distance is our friend, but should we be which one should we be more concerned about, the cellular connection or the Wi-Fi connection? Any thoughts on that?
Well, for the router as well, most people do not sleep with their routers, put their routers in their bras, and put it next to their head all day long. So again, it's the distance that we're concerned about. But for schools, we're very concerned that the people installing different systems in schools are assuming they must be wireless when in fact wired is faster, cheaper, smarter, and safer. So we are promoting wired over wireless, and if you must give an iPad to a young child because it's a really hip, cool device, put it on airplane mode after you've downloaded whatever it is you want them to learn or look at. Remember this, they're called tablets because they belong on tables. They do not belong right over the gonads of young developing bodies. There's no way an iPad should be given to a young child when it's connected to the internet. And in fact, growing numbers of developmental psychiatrists are very concerned about the effect on the developing brain. So overall, for wireless as for phone, distance is your friend, and whenever possible, wired is a better way to go. And it will save you money because you don't have to buy all these different routers if you have to plug something in. I'm concerned about building design and building code now because we want to make sure our new buildings have the right Cat 5 and 6 cables so they can take wired fiber optic connections. For your information, South Korea has broadband speeds that are 100 times faster than the United States because they have fiber optic cable to homes and businesses. That's the way to go, and we'll make more money, there'll be more industry, and everybody will be safer.
So let me kind of follow through with that. Go ahead, Dr. Harness, go ahead.
No, Dr. Davis, for years I've been carrying my cell phone in a holder on my belt near my right hip. What sort of impact have your studies shown? I grant you that's next to my body.
Yeah.
There's an increased incidence of sarcomas, increased incidence of anything else?
You know, again, Dr. Harness, I would welcome your help in identifying, perhaps with Dr. Bevan-Thomas, whether there is anything we can report here. But I can tell you, I have a number of people who've come to me with numbness and tingling in their hip, or what they call phantom ringing, and other symptoms some people get. Not everybody gets this. And just like for most of these things, particularly in epidemiology, when you're dealing with a rare thing, like we are with glioma, which has an expected rate of 7 per 100,000, if it were to double or quadruple, it would go to 28 per 100,000. It would be very hard for us to find it, and we will not find it in the general population, nor should we be looking for it. But I think as to keeping a phone on the hip, what I would say is put it on the other hip. Switch it off and on, and put it on airplane mode whenever you can. Now, I know you're on call. You can't do that a lot. I think we're going to have to see a resurgence of new fashion of MRSAs, men's purses, and things like that.
Ooh, MRSA.
Todd likes those.
Yeah. Now, another quick question. I've got my cell phone right here. Is anything being done as far as shielding the phones more? Where are you with the industry on trying to shield the phones better?
I have actually had conversations with several major manufacturers. They're moving ahead. They hold some patents. In addition, there is a company called Pong Research, which sells cases that have been tested and evaluated by CNET that do reduce radiation. And I use that kind of case myself, but I don't keep a phone close to my body even so. And I think it's very important for people to know that, and know, especially for your general audience, that a cell phone is not a toy. It should not be given to very young children to play with, except if it's on airplane mode.
Well, it's really interesting food for thought. I would be surprised in the next 10 years that if we didn't know the specific answer to this question. But could we go around the room in our closing minutes and find out if there are any questions from Dr. Harness and Dr. Bevan-Thomas?
Well, I'll start off, Todd. I think this has just been an excellent Google Hangout, and I hope we can widely distribute it. I think the warnings that Dr. Davis is giving us is really spot on. In the world of breast cancer, I say time is our friend. But I love what Dr. Davis is saying, that distance is our friend when it comes to cell phones. And clearly in my world of breast cancer, keeping the cell phone out of the bra is mandatory.
I saw a young woman at the gym. I was with my wife, and she had the cell phone in her bra, and I wanted to say something, but it didn't feel appropriate. Just let it go when I see it, right? Don't go up to somebody and
No. Actually, we want to work with Breast Cancer Action and Breast Cancer Answers to develop a very discreet little card that says, "Would you like to know?" That's kind of and pink with a nice little logo. We're really, I have a sample I'd like to share with you after we get off this call. We think it's very important. You don't want to be in people's faces, but we think people don't know. They don't know. If they knew it was a two-way microwave radio, if they knew that manufacturers recommend keeping it off the body, people would never put it right next to the most sensitive tissue that they have.
Dr. Bevan-Thomas?
Yeah, I think this is a great conversation. I think a couple things. I mean, when you talk to people about topics like this, the first thing that comes to mind is that there's sort of some conspiracy theory that the government's trying to kill us with cell phones, and I think that that's obviously not the case. And people start thinking about, well, they've tried to suppress the evidence, and I think there is some interesting evidence out there that says, and it's pretty easy to do. It's not like we're telling people to basically go live in a cave and not use your cell phones, but I think that there's easy things that you can do. I think that the one thing I think is number one is just be really careful. I think the problem is that we've become so attached to our phones, and certainly as physicians, we got rid of our pagers. We went from the Marcus Welby age, over to the Jetson age, where we have our cell phone with us all the time. People are texting us all day long. But I think that just like many things in life, sort of knowing what you eat, it's sort of hard to eat healthy these days, but it takes a little bit of effort. And I think that there's one thing that we learned from this is just be smart, man. Like think about the fact that you're right, it's not a toy. Think about how it's going to affect the kids, and think about some simple things that you can do. And it's not, and what I'd like to do as a follow-up is I'd like to get some of that data and some of these papers that are written out there, because I think that there's the science behind this thing, and I think that many of us are too busy, at least in the physician world, like we're too busy, basically treating cancers as opposed to really looking for, necessarily the exposures for these things. And I think they're simple things to do.
That is your job, and it's important to do it well. And I know, having lost both my parents to cancer, I know how important that is when you're dealing with the disease. You're on the front line, and I appreciate that that's not an easy thing to do. At the same time, figuring out how to prevent cancer and figuring out how to prevent recurrence. You both know that prostate and breast cancer are survivable diseases. They're chronic illnesses nowadays when properly managed. That's the good news. That's because of the advances that you have made in medical care that have been amazing with respect to these illnesses. And I've seen that in my lifetime. It's no longer a death sentence to get either one of these cancers. At the same time, we do have to do a better job of communicating. And I want to ask you, we're developing some materials now that I will share with you that we want to distribute more broadly. At Yale University Medical Center, every woman who walks in pregnant gets a pamphlet telling her how to be safer in using her cell phone, because Dr. Hugh Taylor, chairman of OBGYN, and I have worked together to develop these materials. They're available. We'll make them available to you as well. Pregnancy, as you know, is a very vulnerable time when women want to learn more about what they need to do. But diagnosis of cancer is another vulnerable time. People are always racked with guilt. What did I do wrong? We want to give them information to empower them. So I'd like to work with you so that cancer patients know how to use these devices more safely. They're not going to go away. They've revolutionized our lives, often for the better. Our ability to respond to emergencies is incredible. Our ability to do business is revolutionized as well. At the same time, you can't call it a smartphone if it kills brain cells. And we've got to learn how to be smarter than our phones. And I think we can do that. And we at Environmental Health Trust are really pleased to be working with growing numbers of people in the medical community. I just came back from spending a month in India, where I worked with the heads of the Pediatric Association, OBGYN, internal medicine, and a number of major businessmen who are interested in developing business opportunities here, because the companies know there's going to be billions, that's with a B, billions to be made in coming up with safer devices and safer systems, whether it's more cables or better cases or et cetera. And I have a very specific suggestion that I would welcome your support for, and that is 2 cents a month. Would you give 2 cents on every device, from every user, from every manufacturer, from every provider, over a period of 8 years, to create the billions that we need to study and train people in this field? Because I started out in this 10 years ago knowing nothing about this. And I think it's hard for anyone to understand it. We need more research, and we need to have an investment in that as a nation.
Well, it sure is interesting. Think about this. 1995, I got my first cell phone. 20 years later, I find out that I'm in the middle of the world's largest case study, and I'm part of it. And eventually down the road, we might discover that cell phones do cause cancer and a variety of other things. And in the meantime, keep those phones at a safe distance across the table. If you're going to be putting it in your back pocket, put it on airplane mode until you get to another place where you want to turn it back on. Be smart about it. And we're going to keep a close eye right here at Breast Cancer Answers and Prostate Cancer Live on how cell phones affect your overall health and the cause of cancer. So on behalf of Drs. Rich Bevan-Thomas and Dr. Jay Harness, Dr. Davis, thank you so much for joining us. For more information about Dr. Davis and her book, The Secret History of the War on Cancer, and the other book, Disconnect, The Truth About Cell Phone and Radiation, Dr. Davis, where can people go to get more information?
To my website, environmentalhealthtrust.org or ehtrust.org. Like us on Facebook, Environmental Health Trust. We have Twitter. And as to more technical lectures that I've given, those can be found on YouTube, including one that's been downloaded apparently 1 million times that I gave to the National Institute of Environmental Health Sciences, and one I'm going to be giving in 2 weeks to the state of California, which we will provide you with a link so that clinicians and others interested in this can see some of the technical information. This is not a easy issue. It's complicated, and the complexity makes most people throw up their hands because nobody wants to give up their phone. We don't have to do that. We just got to be smart about how we use them.
Yeah, really good advice. Thank you very much from the three of you for joining us so we can help educate the growing audience out there. And we look forward to giving you an update right here at Prostate Cancer Live and Breast Cancer Answers.